so today we're going to talk about the general anatomy of the tongue. So I've drawn here the side of the head with the nasal cavity and the mouth and the tongue, just to illustrate that the tongue is a muscular organ situated in the floor of the mouth, but it's a lot larger than it looks from the outside. It sits partly in the oral cavity and partly in the oropharynx. So here you can see that the pharynx is split into three parts: the nasopharynx, the oropharynx, and the laryngopharynx. So while I draw the mouth for the next part, I'll just explain some of the functions of the tongue. The tongue is a muscular organ situated in the floor of the mouth, as we've said, and its known functions are taste, although other functions include helping to form words to speak, like I'm doing just now, mastication, which is just a fancy word for chewing, and to help the food move from into the oropharynx as part of the swallowing action. The tongue's made up of a root, a body, and an apex, which I'm trying to illustrate here. The root is the part which is attached posteriorly and includes the nearly vertical posterior surface of the tongue. The body of the tongue is the anterior 2/3 of the tongue, with the apex being the very tip of the body, and it rests on the incisor teeth at the front. The tongue has two surfaces: the dorsa, or the top of the tongue, and the inferior surface, or the underside of the tongue. The inferior part of the tongue is connected to the floor of the mouth by the frenulum of the tongue, which is a bit you can see if you lift up your tongue. It looks quite stringy. The dorsum of the tongue is then also split into two parts. So you have the anterior and the posterior. The anterior part is in the oral cavity, and the posterior part is in the oropharynx. The border of these two parts is made by what's called the terminal sulcus. Sounds fancy, but it's just a V-shaped groove, and this groove often points to a part called the foramen caecum, which is an embryological remnant, which isn't always present. There's also a midline groove, which divides the anterior part of the tongue into left and right halves. As we know, the tongue is an organ responsible for taste. I'm writing lingual tonsil here, but we'll come back to that in a second. As for the taste, the anterior part of the tongue has four types of lingual papillae. Papillae are small structures on the surface of the tongue which give it the characteristic rough texture. The four types are circumvallae, foliate, filiform, and fungiform. Circumvallae are large and dome-shaped and are directly anterior to the terminal sulcus, and they are arranged in a V shape. They have a cleft surrounding them with the walls containing taste buds. Foliate papillae are found on the margins of the tongue and are small folds, and they're poorly developed in humans. Filiform papillae are long and conical shaped and are the only papillae to not have taste buds. And finally, the fungiform papillae can be found mostly at the apex and margins of the tongue and are mushroom-shaped, pink or red spots amongst the filiform papillae. The posterior part of the tongue has no lingual papillae, but as mentioned already, has lymphoid nodules known as lingual tonsils. So the tongue is a muscle covered in mucous membrane. There are two types of muscle in the tongue: extrinsic and intrinsic. The extrinsic muscles include styloglossus, hyoglossus, genoglossus, and also palatoglossus. The intrinsic muscles include superior longitudinal, transverse, vertical, and inferior longitudinal. It's also good to point out here that all the extrinsic and intrinsic muscles of the tongue are innervated by the hypoglossal nerve, which is cranial nerve 12. Except from palatoglossus, which is innervated by the vagus nerve, which is cranial nerve 10. The mucosa of the anterior 2/3 of the tongue, so the front, is supplied by either branches of the facial or trigeminal nerves, so 7 or 5, respectively. And the mucosa of the posterior third, or the back of the tongue, is supplied by the glossopharyngeal nerve, which is cranial nerve 9. The facial nerve is supplying the special sensory to the tongue, whereas the trigeminal nerve is supplying the general sensory. The glossopharyngeal is doing both for the posterior third of the tongue. I hope this video has been useful for you, and please do go and try some of the quizzes to see how much you've learnt.